Hello and welcome to Making the Cut, the podcast dedicated to everything plastic surgery, health, and wellness. I am your host, Dr. Patrick Basile, board-certified plastic surgeon from Jacksonville Beach, Florida, and I am joined by my co-host, the amazing and talented nurse practitioner, Hope Gulley. All right.
Number 5.
Number 5.
It's flying.
It's flying.
It's crazy.
Yeah, so we've definitely started our journey into kind of what we're offering now, which is cool.
It's awesome.
We're really getting into the meat and potatoes, for lack of a better, lack of a better, whatever. But episode 5, we're going to call it Mommy Makeovers, what they are and what they are not.
Yes.
Yeah. So I think
it's exciting.
We've definitely kind of established ourselves in this area as really doing a lot of mommy makeovers.
We do.
And so I think it's really important because some people are like, what's a mommy makeover? What is it? You know? And so really important for us to kind of go over exactly kind of what that is. What would you call a mommy makeover?
I would say a mommy makeover is going to address multiple things. So typically it's going to address abdomen and breasts.
Sure.
On average. What are some like specific like surgeries that can be included with that?
Yeah, so good point. More than one area, right? So for a breast surgery, it could be breast reduction, breast lift with implants, fat grafting. So those are some of the more common ones with breasts. With abdomen, it's going to be abdominoplasty, and there's a variety of different types of abdominoplasties, from a mini all the way to like a big fleur-de-lis where we put an incision down the middle and across the abdomen. Again, more common with weight loss, but we have a lot of mommies that also did weight loss too. So
absolutely.
Again, I think those are kind of the two big areas, but like it's more than one area. So we could lipo the arms. We could do Renuvion, which is that thermal energy-based skin tightening.
It's beautiful.
Of the thighs, address the gluteal areas. So really, I think it's not a one-size-fits-all label, but I just think it means like we're going to address several areas and, kind of try to get you to, or the patient, where their goals are, you know? And we have women coming in, again, asking for all different types of things.
Absolutely.
Right?
Yeah, totally. I think it's very, what are some, like when a patient comes in and they're wanting kind of like multiple things, I think a very common question that we get from our patients is going to be like, do I have to do it all at one time? Can I stage it? Like, what's the options?
Yeah, that's a great kind of that, let's call it the common myths to bust,
yes, right.
First off is, interestingly, you don't necessarily have to be a mom to have a mommy makeover.
Right? Yeah.
Because I think
that's my favorite myth to do.
It is, right? A lot of what we do and show, some of them are patients have never had kids, but whether it's from I think it just goes along with it because a lot of what we post are mommy makeovers.
Yes.
And these patients, whether it's due to weight loss or aging or whatever, would benefit from sort of the combined thing. And they just come in, they're like, I think I want a mommy makeover, but I'm not a mom. Is that okay? So that's one of the things. The other thing is, 'cause some of the myths is that it has to be all done at once.
Right.
And that's just not true. In fact, I would tell you that if you go to places where they're like, oh yeah, we'll do 12 hours of surgery on your lunch, like we say, run. Run.
Please.
Because there is a safety factor with the length of anesthesia and how well you'll do. And
absolutely.
Also, some of these procedures don't go well together at the same time, I tend to like to address the front separately than the back, lower back in particular, or the gluteal area, because I think it's opposing forces. It's
definitely
a vector, right? If I'm pulling you forward, how can I pull you backwards?
Right.
And so for me, I just
healing
get
and
better,
everything.
better results there. The other kind of thing is, a lot of moms come in and they're like, I don't want to feel like vain about this, but it's not about the looks.
Yeah.
So Hope, tell us a little bit about when I say it's not about the looks regarding functionality. What do I mean by that?
Yeah. So it's interesting. This is a conversation I feel like we have all the time with patients, is when you are coming in, especially for a Mommy Makeover specifically, and we're just using that example. Like, I'm going to use the example of it as a mom coming in, right? Yep. This is not only a physical, like surgical journey. This is very emotional too. On so many, I say this is like the biggest onion you'll have to peel, you know, in probably the decent amount of time. Yeah. But what that means is you're coming into us and you probably haven't done something for you in a very long time. And so there's that layer of the onion. So there's a little bit of like what we call mom guilt. There's going to be, you know, a lot of emotions where suddenly you have to rely on a lot of people where you're typically the one that's relied on. And that's something that we don't take lightly at all. Yeah. And especially around the time of pre-op, that's a big conversation that we have is our staff is very well trained, not only in like the surgical component, you know, obviously you are, and then you know, anyone who's taking care of you with us after surgery as well. But we're also trained to help you emotionally too. Yeah. I tell patients all the time, it is not a bother to any of us if you call and you're like, I'm just having a moment and I need to talk to somebody, because that's a huge part of it is we're not just here for the physical part, we're here for the emotional part too. Because that is, I would say it's pretty 50-50 in your recovery, you know?
Totally. And again, one of the other things is there's a lot of patients that come in that like, as they're telling us that they're actually tearing up because they're like, I just feel selfish. I can't believe I'm going to put myself potentially in harm's way.
Absolutely.
I have a family at home. Yeah. And so we spend a good amount of time talking about like safety. Right? And one of the things I tell them all the time, I go, you're putting yourself in much more danger getting in your car and driving home.
Absolutely.
If you're healthy, you know, if you know, definitely if you've had surgery before.
Sure. It's good intel.
But if you're healthy, everything looks good for what we're going to be doing. Really, the risks are very low.
Exactly.
But there are risks.
Always.
And again, but most of those, you know, risks we identify. And if the risks are too high, we're not going to do surgery.
Exactly.
We say no.
We will say no.
And we've certainly said no to people that once, you know, they'll come in and we vet them medically. We're like, yeah, you have a couple of things that medically make this very risky.
Yeah.
And one of the things that we try to do is minimize the risk.
Always.
The other thing though is, you know, aside from the emotional component, looking better, it's the functionality of like the anatomical stuff. So I'll have patients come in who have really bad what's called diastasis recti, or the muscle separation. And obviously there's the emotional component of that. Like, oh my God, I was at the gym and someone came up to me and asked me when I was expecting. And I had my baby 3 years ago. Yeah. Because they're a lean patient, but they've lost the muscle control. So when we're doing these things like abdominoplasties or tummy tucks, and we're repairing these muscles and putting them back together again, that's a functional thing, right? That's not a vain thing.
No.
We're going to improve their quality of life.
Absolutely.
Because we're going to give them better core strength. We're going to, you know, help back pain. All the things, you know. And then also there's the whole part of like clothes fitting better and everything. But I think, you know, one of the big things is, again, just knowing that this is not a vanity thing.
No.
And it's not a selfish thing like you talked about.
Yeah.
And
Yeah, I think something that is very important to speak to as well is you know, we use the term vanity, and I think that what we need to reframe it to is we're going for confidence. We want you to feel good in your body. We want you to be able to do the things like with your kids, with your family, with your friends, you know, the way that you want to. So I always, it's always in the pre-op, because the pre-op is like, we're in crunch time now and it's kind of settling in that we're having surgery in a month. And so this is about confidence, and we're here. If your goal is to be, you know, we're here, we want to get confident here. Our secret goal is actually get you way over here. Yeah. And my favorite part of that is like you said in previous podcasts, is when patients come back to us like 6 months later, the confidence that walks through the door, and then functionally you're able to, you know, do the exercises and do the things that you want.
Because they'll look good. What I'm saying, they'll look good at their like first visit and their second visit, but obviously at those visits they're not working out or know the strength. So, you know, we kind of look at each other and we're like, yeah, you look good now, but just wait.
You wait.
And then they come back and they're like, oh my God, I ran a half marathon. Or I'm able to do Pilates now and not have everything kind of just like, you know, hang. So
and it's the confidence that comes back through the door. It's really phenomenal.
All wrapped in one, right? So you fix it functionally, you'll feel better emotionally.
Yes.
And then you'll look better. And it's a really amazing thing. So it's one of the, I think a recurrent theme is patients come in, they have a lack of confidence and they just want to feel like themselves again.
Yes. They want to be restored again.
That's sort of the biggest thing.
Yeah.
Right. And let's go back to plastic surgery, restoring form and function.
Yes.
So it's one of the most important things like that. So the other thing I think is, we do have a common or like the most common patients, right? So most of our patients are probably in their 20s to 50s, but we do like grandma makeovers.
Yeah.
Right?
Oh yeah. There's no age cap, guys.
and more than ever.
Yes.
We'll have patients come in. They're like, am I too old for this? I'm in my 60s and I have grandchildren, but this is like the first time in my life where I'm now like retired and I have the money and I can take the time off. Do people do this? Yes.
Yes.
They do it.
Always. Yeah.
And some of those patients, like, it's so empowering to them.
Absolutely.
And it's so rewarding to us.
Totally.
Because it's like, they're like, who we would never have known. Like, so even though it's labeled as mommy and people think mommy is younger, it's not. It goes way up into adulthood, especially if you're the type of person that put off doing anything for you your whole life. And now you're finally like,
it's time.
Yeah. And I mean, we've even had those sad stories of like, my husband passed away last year.
Yeah.
I'm doing this for me now.
Yeah.
I have and so
absolutely.
Those are really great because we're really giving people the ability to feel better.
Yeah.
About kind of like what they do. And, I think some of the most amazing things are the stories. Yeah. I mean, you know.
Yeah, it's beautiful. And I think that that's where like the patient journey is such an honor to walk through because it's a journey. It's especially the Mommy Makeover procedures specifically. It's a journey and we walk with you through it because it is tough. Like this is not for the faint of heart for sure. But learning those stories and getting to help patients again along that journey of confidence. That's what we do. You can come in and say like, we want X, Y, and Z, but the underlying kind of theme of every patient that walks in is like, I just want to feel good in my skin and feel confident.
Yeah.
And that's a beautiful thing to work with a patient for.
I think one of the other really helpful things is, and this is with the advent of social media, is all the like Facebook mom groups that are out there.
Yes. Yeah.
And the nice thing is people are talking and they're talking to each other. They're asking. People are asking questions and people are answering questions.
It's great.
And I think, for a long time, again, with the stigma of plastic surgery, particularly back in the 80s and 90s, no one talked, Yeah, so it was sort of like, it was a hidden thing. It was like, you didn't know,
Yeah.
So more and more we find that someone will come in. And I always ask, even though I know because it's written down or they fill it out, like, how'd you hear about us?
Yeah. And
they're like, oh, I was at the gym with a workout buddy. And I said, where you been? And she's like, oh, well, I had this done. And she's like, really? I would never have thought you needed this done. And then they, they go over like what they did and they go, well, I have that. And I didn't think it was anything that they could fix, or I thought I was too old.
Yes.
Or like I thought I was being vain because it wasn't that bad.
Yes. Yes. That's a big one too, I would say. Yeah. And just, it's again, that conversation and not feeling alone in it. And I think that that's something that social media and just people being more open with it as time goes on has really helped. And,
while I absolutely love all patients we take care of.
Absolutely. Yeah.
The moms in particular, even if you're not a mom, you get this Mommy Makeover. Yeah. Like, for our like patients that don't have kids, but they benefit from like these Mommy Makeover procedures is like, just like the fulfillment it gives.
Yes.
Because we truly are changing people's lives.
Absolutely. What's probably like your favorite part of that journey for you as a surgeon?
Well, like you said, the when I'm in there doing the initial consult, or we are, and you see the anxiety, you see the despair sometimes.
Yeah.
Some women are like, oh my God, I had a bunch of kids and I'm embarrassed to take my shirt off in front of my husband.
Yeah.
And, this is the other good thing, because I'm glad we brought this up, is it's super helpful when our moms bring their significant others.
Yep. And
the significant others, they always say the same thing. I'm here for her. I told her she looks great.
Yep.
Doesn't, matter to me, but most of them are super supportive. I don't understand it. I go, okay, you're going to understand it.
Yes.
Because this isn't about you. Yeah, you love her. You think she's perfect.
Of course, yeah.
It's about her. And I'm telling you, when you see the change in her confidence,
oh, it's beautiful.
Our tagline is inspiring confidence.
Yes.
When you see that change in confidence, you're going to be like, I get it.
There it is. Yeah,
I get
exactly.
it. And that's what we do, and that's what we see. And so it is cool, like down the road, 6 months to a year when we're doing our long-term follow-ups, or if I'm out and I see like a patient and her husband,
and they'll run up.
They're like, oh, it's my favorite guy, or but
totally.
they get it. They're like, Doc, I get it.
Yes.
I understand.
Yeah.
Why. And I'm like, good. I think it's really important.
Definitely. And I think something that's beautiful about like what you said too is as we are on that journey of confidence throughout like the surgical process. And when you start to feel confident and you start to feel inspired, like in your own skin, that touches everyone around you. It can be coworkers, it can be, spouse, family, friends, what have you. But that also I think is what triggers that conversation and why people are talking more is like, oh yeah, I notice a big difference like in you, like what's new, what's going on. And it's a conversation.
Yeah. So it's
beautiful.
Super rewarding. And it's, it dives so much deeper than vanity.
Totally.
In fact, vanity
it's not even there. Yeah, totally. It's not even there. Rarely is.
And so I've just really, really enjoyed being, because, obviously I love kids. And when people have children, whether it's one or many, that gift of doing that for their family sometimes wreaks havoc on their body and can affect them emotionally, functionally.
Yep.
And all the things we talked about.
Deeply.
And to be able to get them back to where they were or where they want to be, super cool.
Yeah.
So
definitely.
Yeah.
I think it's awesome.
I mean, I think, we've definitely gone over a lot about what the Mommy Makeover it is, what it's not.
Yes,
talked
definitely.
about the different things of what you can do. And we'll dive into, I think in the future, the individual surgeries kind of a little bit more in depth, the nitty gritty about what it's like for the, the recovery of that procedure and things like this. But I think what I hope we're able to convey is, when you see Mommy Makeover or if you hear someone saying like, oh, I got a Mommy Makeover, kind of what you know. So
right.
Anyway. All right. So we're going to go into our favorite part. Well, no, our favorite part's the other stuff. But, so again, if you're new to us, what we like to do, what we do in the office during clinic day, just if we have a little bit of gap of time, helps us have fun and also get to know each other is the question of the day. Yes. And it can be really deep, like deep.
Really deep.
Or it could be like as easy as like, what's your favorite type of ice cream? But,
which is our go-to question.
So today is my day to be able to ask.
I get to get surprised.
So I think the one I want to say is if you could play any role in a movie, what role would it be?
Oh, I think you already know.
I know, but maybe they don't know. Yeah.
So I am like deeply obsessed with Julie Andrews. like wildly. I just love her. She's phenomenal. So definitely Maria in The Sound of Music. Yeah.
Okay.
It's just such a beautiful role and it's so diverse and it's complex, but it's just beautiful.
Now I imagine you know all the words to the songs.
Yes, absolutely.
And I imagine when you're at home cleaning and it's playing, you're singing it.
Oh, can't help it. Can't help it. Yeah.
And it would be obviously an amazing achievement to be able to meet her.
Oh, we talk about this a lot. Yeah.
I mean, I would love to fly her in.
We've talked about this at the office where he was like, what would happen if I like flew Julie Andrews in? And I was like, I would like be on the floor crying. It would be a lot. Yeah. What about you?
Well, we love that movie and I love her in particular.
Yeah.
She's great. Mean, it's so great. And she's so diverse.
So
as an actress.
Yes.
But in that role,
she's great.
Was just great.
Beautiful.
I always I'm going back to The Godfather.
I mean,
but which role?
Yeah.
I don't know if I'd want to be Don Vito or Michael, and I think it's going to be Michael.
Yeah. Why?
Yeah. Well, because Michael really changes throughout the three movies. I'm going to include the third. I know people are going to hate that, but he starts out very naive and innocent, and then he establishes his family role, and you see the change in his character of what that does to him. and the sacrifices he has to make and the consequences of what it does for his marriage and his relationships and his family to assume that role.
Yeah.
And then in the last movie, even though it's not that great and people give it, don't really like it, it kind of just shows that he was really trying to get back to being a normal guy. And it's like, it's a true tragedy.
Yeah.
But again, the acting is amazing. Al Pacino, incredible. And it's just, it's a movie I can watch over and over again, like Sound of Music.
Yeah, yeah.
And I just enjoy it because I pick something new every time.
Yeah.
And I'm like, oh, wow, that's very clever.
Yes.
But it's, but the funny part is in some of his other movies, I'll see him doing like a similar voice. I'm like, all right.
You're like, all right, there he is. Yeah.
But anyway, yeah, so I think that's it. But
yeah.
All right. So great episode.
Yeah.
Mommy Makeover. Again, if you guys have any questions about Mommy Makeovers, please send them over. info@patrickbasilmd.com, the E on the end of my name. Also, if you have any, want us to talk about any topics at all, we're open to that. Or any questions of the day. If you want to throw them over to us.
Yeah, I was going to say,
be happy to answer
we'll be
that,
surprised together. Yeah.
It's like Alice from Alaska wants to know what's your favorite car.
What it is, yeah.
But we look forward to our next episodes coming up. And we have some great content that we're, for this first season of Making the Cut that we are very excited to get out there. So, but thank you, Hope.
Awesome. Thanks, Dr. B.
We'll see you in the next time.
Sounds good.